Recognizing the member from Vernon-Monashee.
Thank you, Honorable Madam Speaker. Today, I rise in this House to highlight the importance of supporting internationally educated healthcare professionals to support our existing healthcare workers and to strengthen our healthcare in our province. I want to share some of the key investments that are being made by taking multifaceted approaches. Madam Speaker, we know that the pandemic, opioid crisis, and many pre-existing gaps in healthcare sector has intensified the strain on the entirety of the healthcare system and has been tremendously difficult on our healthcare workers. This is an issue that all jurisdictions are facing nationally and internationally. We know that the success of our healthcare system depends on various important professions and roles, whether they are professionals or working in support services. They are equally valuable, integral part. Therefore, our government is constantly investing in to support all healthcare workers. As an internationally educated nurse and as a Parliamentary Secretary for Senior Services and Long-Term Care, today I will talk about the importance of internationally trained healthcare workers and how they can be an integral part to help us meet the needs. Madam Speaker, while our government is constantly building and strengthening our healthcare system by adding more seats for healthcare professions, we know that the internationally educated healthcare professionals can also help to fill these existing gaps, and when we support them, they can be ready to help our healthcare system sooner. Internationally trained professionals bring wealth of knowledge, wide variety of lived and professional experiences, dedication, and resiliency as they often worked under very complex situations. I too had the honor to contribute to BC's healthcare system for nearly 2 decades, and every single day I am immensely grateful for this opportunity to work in our healthcare system and to build my life here in this beautiful province. However, my journey going through the international credentials evaluation and process was not easy, as it took me a long time to finally become a registered nurse in BC. Therefore, our government has now taken significant steps to remove bottlenecks, in other words, unnecessary barriers to make it easier for internationally educated healthcare professionals. This is also why we invested $12 million to support internationally educated nurses to practice here in BC by simplifying the application and assessment process for internationally educated nurse candidates, offering approximately $9 million in bursaries to help with assessment fees, and creating new nurse navigator profession to help internationally educated nurses navigate the assessment and licensing process. This includes $1.2 million to the BC College of Nurses and Midwives to streamline the regulatory assessment pathway called Triple Track, $9 million in bursaries to remove financial barriers for assessment, $2 million to Health Match BC to support enhanced recruitment and system navigation, including refreshed marketing and website. Triple Track, Madam Speaker, will streamline the assessment pathway so internationally educated nurses can be assessed for multiple professions like healthcare aide, LPN, RN, simultaneously reducing red tape, cost, and time. In this new process, internationally educated nurses are simultaneously assessed for HCA, LPN, and RN designation to determine where they are best positioned to enter in BC's health workforce. This will allow them to work as an healthcare aide or LPN while they upgrade their training to work as registered nurse if they so wish. In addition, we recently announced significant expansion of pathways to licensure for internationally trained physicians that will improve community-based healthcare delivery in British Columbia. We also added a total of 270 new ongoing allied health seats to BC's public post-secondary institutions, as well as additional one-time support to meet immediate training needs for medical lab assistant, and a new program to help internationally educated advanced care paramedics to join the workforce. Growing these programs and increasing BC's supply of highly skilled graduates will ensure that our province has the right health professionals in the right places so British Columbians can access the health services they need now and in the future. The province is expanding the Practice Ready Assessment Program, which is a pathway for internationally educated family physicians to be licensed to work in BC. This program will triple from 32 to 96 seats over the next 16 months. Internationally medical graduates who are not eligible for full or provincial licensure in BC may be eligible for a new associate physician class of restricted registration with the College of Physicians and Surgeons of BC. This will allow them to care for patients under the direction and supervision of an attending physician within a health authority and acute care setting. On September 29, 2022, the Ministry of Health announced a comprehensive provincial health human resource strategy as outlined in Minister of Health's 2020 and 21 mandate letter. It utilizes a broad-based framework which will look at the full spectrum of health workforce issues from education and training, recruitment and retention strategies for a wide range of healthcare workers' occupations. This strategy focuses on 4 key areas: retain, redesign, recruit, and train. The HHR strategy outlines 70 actions, Madam Speaker, which will help build and support healthy and productive workforce. These actions address staffing capacity issues throughout the healthcare system and will help alleviate the burden on our healthcare workers. We've opened up several avenues to increase number of nurses, physicians, and allied healthcare professionals, both those trained here in BC and those trained in other provinces and countries. New education programs are being created and other programs are being expanded. All steps are critical to increasing our supply of family doctors, nurses, allied healthcare professionals, and helpful to improve our healthcare system. Thank you, Madam Speaker.